Now, after the range of motion testing, let's come up to the restrictions in the muscle. So the major muscles which are tight and which are facilitated more, they are the pectorals as well as the traps and the suboccipital muscle along with the levator scapulae. Right? These muscles we are going to check for the restrictions. So initially when we are going to check for the pectorals, what we are going to do, we'll ask the patient for flexing the elbows to 90 degree and then raising them up. Keep the hands behind the head, right, at the area of the occiput. The fingers will be interlocked and the therapist will pull the elbows back. So what will happen, the patient will be having a stretch or a discomfort in the area of the pectoralis major. Okay, so this will become a positive test for pectoralis major if patient will experience increased stretch or discomfort in that area. Right? Now comes the pectoralis minor. The patient has to lie down straight, supine on the treatment couch, and then we have to place the heels of the hand on the coracoid process and then push it down towards the couch. Right? If the patient will experience certain stretch or discomfort, this means the pectoralis minor are tight. So these two are the tests for pectoralis major and minor. Now comes the upper traps and the levator scapulae. For the upper traps, we all know that there is side bending test, right? Ear to shoulder test. So this we can perform on ourselves. It can be a self stretch or we can do it on the patient as well, right? So it is ear to shoulder. We'll ask the patient to touch the ear to the shoulder. If the patient is experiencing some pain or discomfort, this means this test is positive, the upper traps are tight. Next is the levator scapulae. For the levator scapulae, what we have to do is cervical flexion, rotation on the same side, and then lateral flexion, right? And then the shoulder on the same side is meant to be pushed down so that the levator scapulae will feel more stretched, right? So this is the way how you have to perform the stretch for the levator scapulae. After the muscle length test, now comes the strength test. So whichever muscle is weak, like the deep flexors are weak, along with that the opposite side of the cross, which is made up of the middle traps, lower traps, okay, serratus anterior, these musculature is weak, right? And what is happening in this case is we have to test the strength and endurance of these muscles, right? So first, for the deep neck flexors endurance test, what we are going to do, we'll ask the patient to lie supine. Patient को बोलेंगे वो couch पर सीधा लेट जाए. Patient will have to tuck in the chin and we'll ask the patient to do cervical flexion. Okay. The patient will perform cervical flexion with chin tuck position. Ask the patient to hold this position for 10 to 20 seconds. Okay, if the patient will unable to perform this or patient will feel dizzy or pain in the neck region, this means the deep flexor muscles are weak. They are unable to hold the neck in the cervical flexion position, right? Now, after the deep neck flexors test comes the lower trap strength test. What is happening in this is, we'll ask the patient to lie prone position, okay, and then the patient will lift the arm. For example, the patient is lying prone and then the patient will be in this thumbs up position and lift the arm up against the slide resistance which the therapist will apply, okay, and the patient will have to hold the position like this. Inability to hold this position means there is weakness in the lower traps, due to which there is scapular instability. Now comes the functional movement screening, which is very important because we are going to examine the patient in the functioning position of the daily life. Okay, so for this there are two tests. First is the wall angel test and the second one is the push up test. In the wall angel test, what we are going to do is, we'll ask the patient to stand against the wall with full contact, okay, of the back, of the shoulders and of the head, right? And the patient will be asked Let me show you here. Okay, there will be full contact with the wall, and then the patient will be asked to raise both arms up, and then without losing any contact with the wall, the patient has to bring the arms down towards the side. If there will be any restriction in the range of motion or any discomfort or any stretch while doing this, or the patient is losing contact with the wall because of this, this means this test is positive and there is weakness and restriction in the muscles. Okay, and this is mainly for the pectorals because the shoulder will lose contact first. Now comes the push-up test. What is happening in the push-up test is we'll ask the patient to perform push-up and there is no such restriction, okay? And there is no such restriction or foundation, okay? If the core strength is fine with the patient can perform full push-up, or he can also perform with the knee supported according to the fitness level, right? We are going to assess for the scapular stability and the muscle activation. While performing push-up, you have to look around this area of the scapula, that what is happening here. Is the both sides muscle activated symmetrically, or there is anterior tipping of the scapula more on one side, or if there is any winging of the scapula, you have to look for that. And if this is present, these all tests will help you rule out if there is upper cross syndrome or not. So I hope you found this video helpful and stay tuned for the treatment part. See you in the next video.